Go to the Daily Telegraph. Live and let dine. Love that headline. Lunch tax cut. Pop the Dom Perignon. It's time to pop the champagne corks and get out to lunch with Treasurer Dom Perrottet. Keen for a cut to the fringe benefits tax, Mr Perrottet raised the idea at a CBD summit as a way to pump life back into the city's restaurants, vowing to ask his federal counterpart Josh Frydenberg to scrap the FBT. After Mr Frydenberg later ruled out such a move, Mr Perrottet doubled down, saying he was determined to come up with his own equivalent tax break. Well, look, you can say what you like about Dom Perignon, but he's certainly innovative, he's a reformist, and I like the fact that he's looking at, abolishing stamp duty in New South Wales and coming up with an annual land tax rather than that massive one-off hit, which is basically just a
revenue
tax
raiser,
grab,
isn't it?
It's a revenue raiser, and they're addicted to it. Other states have dismissed it because they're addicted to it, but this bloke is having a crack. I like that.
Look, yeah, he's throwing out lots of different ideas, isn't he, Peter? And look, you'll get a lot of jockeying. Now we've got the budget come up. You'll have all these different groups, and including, state treasurers, all having a bit of the jockeying pre-budget. And you're right, he's talked about land tax, and I noticed there was actually this is partly driven by a big PricewaterhouseCoopers report that came out, I think it was early this month or last month, really having a look at various taxes, including sort of superannuation, but fringe benefits was one of the things raised. And whether it's sort of, be it lunch, etc. Another key area was employers when they have to, and I must say I'm not an accountant, so I don't understand this completely, but often retraining workers, etc. That also brings in all this stuff about fringe benefits tax and something of a disincentive. So that's why it's partly become a big issue, because we got so much change and kind of restructuring of the economy with this sort of mass move to digitisation, if you like. So this is partly why it's coming up more, Peter. So I think we'll hear a lot more about fringe benefits tax.
Let's go to the Hobart Mercury, the voice of Tasmania. Doctors' orders, election demands for broken system. Tasmania's Peak Doctors Association has launched its election wish list. The Australian Medical Association says it needs an urgent $400 million of investment to bring the state's hospitals into the digital age. The body says the Tasmanian system is at breaking point. Well, it wouldn't be the first state or territory in this country to have major health department implications and problems at the moment. We're seeing that in Queensland. And in fact, if you pick up any newspaper in this country every day of the week, there's a litany of health failures. And yet in a modern, progressive country like ours, we shouldn't be having this.
Look, we're one of the wealthiest countries in the world, aren't we, Peter? I mean, health is hugely expensive, and to some spending can almost be infinite, where you get constant new technologies. But, and look, Tasmania is an interesting space to think about in COVID, because a lot of these types of, when you think of the broader movement to regional areas, Tassie's going to be right up the top. I mean, Hobart has one of the hottest property markets in the world. So I think Tassie, there's going to be more population. You've got this state election coming up. So there's a lot of room for debate. Traditionally, Tassie's often very good at attracting these types of resources, because they've often had these sort of kind of wacky senators who have, at least federally, who have these kind of disproportionate power for the people they represent, and they've often been able to attract extra resources for Tassie. But so there's a bit of that here as well, even though it is very much a state issue. So look, I think it's partly a measure of that sort of the urban, regional type divide, where we often have absolutely world-class hospitals in the centre of our cities, but as you get further away, sometimes they're not quite as up to scratch.